A look at what it means to have this vaccine not just in the country but also in Africa as a whole, where malaria has infected at least more than 200 million people, and 584 others have died from this. I just want to cross over to our city center where President Mtalaki is, where Cabinet Secretary for Health James Macharia was currently being grilled by the Health Committee. Let's just understand what was coming out from this. Mtalaki, what is the latest on this update?
Well, thank you so much, Ian. And what the Cabinet Secretary for Health, James Macharia, was supposed to address is there are 4 issues. One was on the NHIF new rates, and according to James Macharia, says that for 10 years the NHIF rates have not been reviewed, and that the ministry felt that this was a time that they're supposed to be reviewed, and he says that this move won't be stopped by anyone, and he says that the new rates will benefit persons with disability and the elderly, for that matter, and the poor. And he says that there was an issue that came up about by the member of parliament for Runyenje's Cecily Mbarere, saying that are being deducted 500 shillings as opposed to 300 shillings, and the ministry came out saying that there's a misinformation with regard to that issue, and the farmers are supposed to be deducted 300 shillings, but the CS also Parliament that this issue will be sorted out through the mainstream media. Another issue that the government to address was about Malindi Hospital, which was one of the hospitals that was earmarked by the government that should be upgraded to a level 5, and this hospital was the first hospital that, as indicated, that was supposed to be upgraded to level 5, and according to a member of parliament for Malindi, saying that he questioned the ministry why, as to until now, the Malindi Hospital has not been upgraded to level 5 hospital, and saying that according to the cabinet secretary, he said that there are some politics in between the Kilifi government, and at one time that the county government of Kilifi officials chased away some of the contractors who had been sent by the ministry to just some procurement. Another issue that the cabinet secretary was supposed to address on was about the issue about the Tobacco Control Board, what it has been doing, and saying going by the cabinet secretary, he says that the board has been doing enough work in terms of capacity building, training, and making sure that all the issues surrounding about the tobacco and the issues about shisha have been addressed, for that matter. Ian.
Thank you very much. That is Francis Mtalaki just giving us an update where Health Cabinet Secretary James Macharia was appearing before the Health Committee. Of course, one of the main issues that was being discussed here are the controversial NHIF rates, which led to a number of union strikes which we witnessed last month.